So the question is, how does Orthodox medicine work with spirituality? And the reality is it hasn't really worked well in the past. And that's really the model that we're trying to bring in here. And Kim and I are working hard on, working together and being a unified force of healing rather than two separate professions, medicine and naturopathy, which for years, eons, have been fighting with each other and hating each other and calling each other names, and we're not. We're just options of healing. I see it as you have a plethora of ways to heal and find what works best for you to heal. It might be a herbal remedy. It might be homeopathic remedy. It might be seeing a medicine man or a shaman. It might be going to psychologist. It's finding what of all the things, of all the tools to heal is the best for you. So to answer your question more specifically, a lot of Orthodox doctors, not to any fault of their own, but when you're trained in medicine, you're trained absolutely everything is science. It's science, and if it isn't proven, it doesn't exist. And so you spend, I spent 12 years of my life learning science. And so everything has to be proven and exist. And then you have this platform that you stand on because you know something, because it was proven. And when you start taking that platform out from underneath those people, all of a sudden they have nothing to stand on. So it's frightening, and it's like jumping empty-handed into the void, as many of us have been asked to do. But imagine for somebody who has been so steeped in science their whole life, and all of a sudden you're saying, you might not be able to prove it, but it might work. That just doesn't make sense to them. And so holding on to what they know, they'll hold on to the science tighter. What I hope to see in medicine is that we do start to embrace, and it's already happening in science, because we're starting to have, we now have PET scanners that can scan people's brain when they're meditating and showing the compassion centers lighting up. And so science is starting to catch up with spirituality, which is fabulous. However, I hope it doesn't then everything still has to be proven. That's the catch there. But science is catching up with the things that we've never been able to see. But if you really truly ask a medical doctor, what do you really know about the brain? I mean, we really know about that much, but we say we don't. So how do you blend spirituality and medicine? It's about letting go of a paradigm. It's about letting go of having to prove everything scientifically, and having everything structured and in boxes. And a lot of the new research is coming out now showing that researchers' intention on the research project actually affects the research project. And it's like, oh, well, okay, does any of the research actually is it even true, any of it? So then doctors are starting to question. And if you've been in medicine long enough, you also realize that, you started out in medicine, you were told this was true, and then all of a sudden now this is true, and now this is true. Hormone replacement therapy is a beautiful example of that. It used to be when I graduated from medical school, if you didn't give it to women, you were putting, it was malpractice. And then all of a sudden it was, if you did give it to women, it was malpractice. It's like, what's the truth? So that is helping to break some of the doctor's shells, that the changing. But we need to be compassionate to them, because they were trained as scientists, and I was trained as a scientist. And so we have to allow them that chance to be able to start breaking out of that shell and that box that they were trained in, and realizing that it's really scary to have no idea what you're supposed to tell your patients. That's really scary, because then what do I do? How do I show up? And it's about then showing up authentically and being real. And there's, there may be a little bit of psychological clarity and psychological training, but there is none in medical training. you're actually trained to, in some ways, almost become a demigod. You know, you're infallible, and I remember when I was in training, I'd walk into the hospital and the nurses would all jump up out of their chairs because there was a doctor on the deck. And I was like, why, you have work to do, right? Yeah. I was like, well, you stay in your chair. But the training kind of puts that into them, instills that. So we have to really have compassion for the medical community and the paradigm shift that they have to take to be able to start embracing it. So what to do for your friends that are spiritual? I think just allowing them to understand that is really important, to have compassion for the medical system, and then to find, holistic doctors that they can work with, and that they can, because one size doesn't fit anyone, We need to have all the things available to everyone. And my hope is to see a healing system that can work together in harmony and say, I'm just really not getting what I really want, the changes I really want for this patient. Do you think you can maybe work with them? No matter what, if it's Bowen therapy, if it's massage therapy, if it's counseling, if it's whatever it is, I'm just really we're not getting anywhere. Maybe you try working with this person and see what you can do with them. But that also takes being able to say that you're fallible. You didn't fix them. You didn't get it right. Hope is probably the most important ingredient in any healing, I think, because holding hope for change, hope that there's another possibility, another way. So I think the most important ingredient, if I can teach doctors anything, the first thing, of course, would be, cord clearing and energy boundaries, because that's incredibly important. But then the next thing would be, how do you hold a space of hope? Even in a dying room, how do you hold a space of hope? I love being with people when they're passing, because you can make it such an amazing experience and such a hopeful experience. This isn't the end. This is just the beginning. And so hope is important in every single aspect. And if you don't hold hope, how does that person then be able to change or to grow? So hope and compassion would be the other place as well. So hope and compassion. But yeah, hope is, if you don't have it, I don't know how people are then able to go on their healing journey. Because sometimes illness is it's the best thing that could ever happen to you, because all of a sudden, I'm sure there's people in this room where an illness or an accident or something happened to you, which then woke you up, and it was like, oh, wait a minute, what have I been doing all my life? Is that all there really is to life? So illness offers that opportunity to really examine your life and really look at what you've been doing and to that change point. And if you can hold hope at that change point, it allows everything to be possible. One of the questions was about what would I say to people in the New Age community who have a mistrust of the allopathic profession. First off, we have this thing when we go to doctors about giving our power away. We walk in a doctor's office and we all of a sudden give our power away. Why do we do that? And again, you don't want to walk in and, I know best, but walk in as an empowered person. Walk in as a person who you're not all of a sudden giving that power away to that medical person. And the system also creates that, because you kind of walk in the door and you start being a number, and you start being so many medical people, you're a diagnosis. Oh, you're the person in room 6 with diabetes. So empowering yourself, having your own self-worth. And then the other aspect is also the fear aspect, because there's a lot of fear in the medical community. Fear that they're going to tell me something I don't want to know, fear that I may lose my job. There's a lot of fear as well. So really clearing that fear as you're going to see a doctor. So what's coming up for you what are the fears that are coming up, and clearing that and using our Cosmosis process to clear the fear as you're going in and being able to be in the clearest space. So being empowered, having your self-worth and your pillars all very strong, your self-determination, your uniqueness, having all your pillars strong, working and dealing with any of the fear that comes up as you're going in, and then work with the doctor. Set up that relationship with them, because if you go in a place of against the allopathic system, then then they're going to be pushing, and you're doing this with each other. Whereas you go in, it's like with your boundaries and your self-worth, and working on your fear, and you present, and then if they say something, well, I'm not really sure that's right for me. Can we explore another way? Or can you have another suggestion? Because if we're anti, then we're only going to get anti back. So, clearing that anti. How do you do that? How do you clear it? I think, again, partly understanding where doctors are coming from, and having compassion for them as a profession, as a medical profession. It's a profession that needs a lot of love. It really does. I mean, the doctors work really hard, and most of them are incredibly good-hearted people, and they really want to do what's best. But there's a system that they get stuck in, or a mindset that they get stuck in, and if we can be compassionate and loving to them, imagine what they can then be back to us. So really giving the profession love, because it needs that. It needs that love, and it needs that understanding and that compassion, and to have hope also that they can change, that the allopathic medical system can change. Because the more we're thinking about it, it's never going to change, it's not going to change. There's a judgment on the system. So if we can hold that hope, and I know myself, going through the training and then kind of going away from the training and then going back into it, I had a lot of judgment as well to my fellow doctors and to people that you're so stuck in the system. But when I stopped judging them and started having compassion for them, you have a much greater ability to change the system. So, let go of the judgments and allow a new experience to occur. Maybe you had a bad experience, and if you go to the doctor and you have a bad experience, you have every right to saying, I'm sorry, this just isn't really working the way I want it to. I'm going to just end the consult right now and thank you for your service and walk out. That's okay. You can do that. If we're against the system, or we're judging the system, we're only creating more of what is there. So, yeah. So Patty was talking about an experience she had in a spiritual community where somebody got pneumonia and rigidly stuck to the spiritual community's dogma of what they should do, and therefore not going and getting antibiotics or the care that she needed, and actually ended up dying. And again, that goes back into the judging. So you're judging one is good and one is bad. Western medicine's amazing. Western medicine developed because of the number of people we had on the earth. When we had shamanism and healers, we could do that because we were in small communities. And that person knew everybody in the community, and the community cared for that person. When we started getting bigger and bigger and bigger and bigger, that no longer was working, and took a lot of time. So Western medicine started coming out because of that, and there were amazing things discovered, like penicillin, and so Western medicine really developed because of the masses, because of the need to serve the masses, and because when there's more people together in a space, illness spreads very rapidly, etc. So it's not throwing the baby out with the bathwater. I mean, there are things in Western medicine that are not great, but there's things in Western medicine that are great. If I cut myself, I want it to be sutured. If I have pneumonia or a bladder infection, and then you need antibiotics, And try something else first, but if that's not working, don't stick, when you get into those rigid dogmas, which is really just extreme judgment, then you're pushing away any other ability to get help and to use all the things that are available to us. I mean, a lot of Western medicine is really from ancient medicine. I mean, you know, paracetamol or Tylenol, for those of you from the States, you know, it's white willow bark. It was a Native American remedy. Digoxin, the same thing, you know, it's foxglove. So many of Western medicines are actually just synthesized, you know, natural medicine. And yeah, you can get into the whole thing about, well, they're not as good when they're synthesized, but still, to get it to the masses, you had to do something. And so don't throw the baby out with the bathwater. And when we get into rigid dogmas, it would start to concern me that we are getting too rigid and we are getting very judgmental and we're getting very anti. You know, and here, one of the things we really encourage is not to be anti, not to be against anything. You know, to embrace things and to, you know, if you start being against, then you're pushing energy at them and you're actually giving them energy and making the problem worse rather than allowing the problem to diffuse and have its natural death. So not to be anti-things and not to have rigid dogmas and you know, part of what we are all here for is because we are individuals and we want our own individual sovereignty. And sticking to dogmas takes that away from us. We lose that immediately as soon as we start sticking to anything that's rigid or dogmatic. And we all know that if we get into judgment, it takes us out of alignment, and you know, we're losing all that progress that we've had. So again, there's good in everything, and it's finding that what you need. And sometimes, you know, it's, you know, one from column A and one from column B, and you know, you might want some egg rolls and some pad thai, you know. You don't have to have all Chinese food or all Thai food or all at one time. So being flexible, being adaptable. I mean, adaptability is so important and such a great sacred quality. Being adaptable. If this isn't working, well, then try something else. But don't, well, this is the only way I'm going to do it because this is the way I'm supposed to do it. You know, be adaptable. It's not working? Okay, well, let's try something different.